This is Cadillac Unscripted on 107.9 CDY. It's sponsored by Independent Bank. It's our first show of our new year, and this is going to be kind of interesting because we have something happy to talk about because this is our 2-year anniversary show.
It is. Happy anniversary, partner.
And we are going to be doing something special for our Cadillac Unscripted Facebook fans.
We are.
But first, we have to kind of pivot a little bit.
We do.
Because we've got on the line with us Dr. Jim Whelan. And his title is medical. You've got it on your phone,
yes,
right?
Dr. Whelan is the medical director for population health at Munson Healthcare. He is also the man of the hour, Rich, because, we said we're going to talk about positive and happy things and progress in Cadillac. And this guy is driving progress via information. He knows what's going on with COVID. Welcome, Dr. Whelan.
Well, good morning or afternoon, guys. Glad to be on the show again.
Okay. How are we doing? Can you give us an update? How are we doing in Cadillac in terms of COVID and cases and hospitalizations and education? How are we doing?
So overall, right now, Cadillac in cases at the hospital is doing a little better than the last couple of months.
Great.
So there's less than 10 COVID-positive patients in the hospital. And our case positivity rate here in Northwest Michigan is behind that in much of the rest of the state, which to us just means that Omicron hasn't really gotten up north in large amounts yet, but we know it will.
Okay.
Are we concerned about the fact that we're in the middle of two very festive holidays in the holiday season and people getting together and traveling and exposing themselves to things that they otherwise wouldn't be had they stayed home? Is there a concern there?
We just know that that's going to speed up the spread. So, and that's true every year, whether it's influenza before there was COVID or with COVID. People want and need to see their families, and they share germs at those events. So just because now it's COVID, we're all so super conscious of it. But we know there will be the arrival of Omicron in northern Michigan after the holidays.
Okay, excellent. Thank you for that. Question, what should we be doing?
So I think with Omicron, I think we just have to kind of reinvest in our kind of common sense approaches. So, wearing masks if we're around others, we should be washing our hands all the time and hand sanitizing. So I think a lot of us, even in the health care, have gotten a little lax on that, but hand washing and hand sanitizing really helps. And then, of course, we know that vaccines keep people out of the hospital and keep people from dying. So we would, of course, continue to encourage everyone who's not vaccinated to get started and anyone who's eligible for a booster to get it as soon as possible.
Okay. Can we talk about the rollout of the booster? How has that gone?
It's widely available. There's no limit on the availability of shots. There are fewer people who've gotten boosted than got the initial set of vaccinations. But that number is going up here all the time. I mean, people watch the news and realize they got to get it done. So we're doing pretty good on boosters. We can always do better.
Okay. What shouldn't we be doing? What about air travel?
Personally, I'd be anxious about traveling by air, just with recent super contagiousness of Omicron. We know anywhere there's going to be large numbers of people and shared air circulation, we're at some increased risk. So, and personally, I wouldn't travel by air right now because I hate when my flight's canceled. It just makes me beat my head on a wall. And they're canceling so many now. It's your air travel's just going to be unpredictable. Okay. But I think we just have to wait a month, and things are going to have quieted down again, and all those things will be much safer.
That brings up actually a couple of questions, Doctor. Delta versus Omicron. The ability to spread Omicron, I have heard and read, is greater. but the severity of Omicron is less than Delta. Is that accurate?
So far, yes. And I mean, we're getting more information every day because there's so many infections. I mean, what did we have? 400,000 yesterday in the United States. And so that is definitely been a factor. So we would say that Omicron, we're getting ready to drive, so if you hear background noise, I apologize. The Omicron is probably 3 to 4 times more contagious than Delta, which just means that 3 or 4 times as many people are going to catch it from each person who has it. But the number of patients who get Omicron who will end up in the hospital or on a vent is definitely looking lower than with Delta. So Delta is pretty lethal. And once you're in the hospital or if you end up on a ventilator, that is bad. People are really sick for a long time. And a lot of the information from areas of the country that have already been hit or countries that have already had large numbers of Omicron where it became dominant, the percent of people ending up in the hospital or on ventilators is quite a bit lower.
Okay. For folks that have the sniffles or are sneezing a lot, I mean, you know,
exactly.
I mean, you're wondering. I mean, I think we all walk around going, "Do I have it? Do I have it? Do I?" What do we do if we think we might have it, Doctor?
So, I think that's really important because we've also already do have some influenza. We had a couple people hospitalized with influenza already. So, I would say that you talk to your primary care doctor, describe your symptoms, and then follow their recommendations. Most offices can arrange for you to get tested for both flu and the coronavirus, and then they'll guide your treatment. But for safety's sake, for the sake of your coworkers and any vulnerable adults or family members you'd be around, I think if you're not feeling in your normal state of health, you should avoid going to work, going to places where people might get exposed until you're certain. Okay. Most of the time now we can get a test result in 24 or 48 hours. So it's not a long wait to find out whether you're at risk to somebody else or not.
I will say, Doctor, since the last time we chatted, it went through my house. I ended up not getting it. At least I don't think I got it. But why don't we talk a little bit about the accuracy of a home test versus going to your doctor and having the thing stuck up your nose and getting that tested. So accuracy of a home test versus going to the doctor and having it done.
So antigen tests, which are the home tests, are, and there's a large number of different companies that sell them and make them. So they are less accurate than a PCR test. The accuracy varies probably in ideal state somewhere around 80%, meaning that you can trust your results, positive or negative, to 50%, where it's a little bit of a coin flip depending on the results. But a PCR test then still remains very accurate for predicting whether you have had COVID in the recent past. If you are having symptoms and your PCR test is positive, you can presume that's active contagious COVID. But that PCR test could stay positive for weeks and weeks, 8 to 12 weeks, even after you're fully recovered and can't give it to anyone. So both tests are most accurate when you initially have symptoms. The antigen tests are very helpful when you don't have symptoms, but you are concerned about going to a gathering or traveling or things like that. Mm-hmm. That said, the PCR test is the only test that's acceptable for some travel, like other countries, especially Canada.
Well, not only travel, doctor, but employers. You know, you go to your job. Some employers are a lot more restrictive and about, if you feel like you've had symptoms, you need to show me a positive test or you need to show me a negative test to come into work. Others are a little bit more lax. So
Yeah. How do you feel about that, Dr. Whelan?
yeah.
So I think that's very reasonable, and the reason is, especially with the more contagious variant, if I were working on a floor of a factory and I had 100 people working that day, and someone came in who was sick, but didn't have a test and just thought it was a cold and decided not to tell anybody, and then I end up with the two people closest to them with it, and the next day the two people closest to them have it, pretty soon I have to shut down a shift. We're seeing these types of clusters even in healthcare. So as an employer, I completely understand they're wanting to see a test. We have to accept that it's not perfect, so someone could have a negative test and still have COVID, but we can only do as well as we can do.
Right. Question, have we become too casual about this? Are we desensitized? I mean, it's been going around for so long. Is there like a fatigue with it in terms of due diligence and awareness and being vigilant?
Oh, definitely, top to bottom. So even in the healthcare, when we're in the midst of it and at high risk all the time, we see kind of a loss of that attention to detail in terms of consistent masking, consistent following all the PPE requirements until we're certain whether someone's positive or negative. And you can see it just out in public in terms of masking and gathering. We're all exhausted. We all miss all of those activities. And it's been really hard to stay vigilant. And so I definitely think we've seen some backsliding in terms of our behaviors. I think it's normal human nature. And we keep asking people, come on, really buckle down. But it is very difficult to get up every day and imagine you have to treat everyone around you like they're radioactive, like we've had to for the last 2 years. Can
I say that there's something that's oddly comforting about knowing that the exhaustion extends to the healthcare community too, as opposed to, us regular folks?
We are hearing it from the horse's mouth. He's tired.
Yeah.
Yes.
Well, and it's healthcare workers are tired in many different ways. The joy in work is definitely less than it has been for many healthcare workers who feel, one, that they're at risk all the time, their health's at risk, but they, just the frustrations of others has been directed towards healthcare workers in many ways, which make it even harder to keep going to work and putting yourself at risk taking care of other people.
Well, and Rich and I just want to say thank you to you and to the healthcare community for taking care of us. We're very grateful.
Especially for those who are making the decisions to not take care of themselves as well as they should.
Exactly.
So I heard a quote yesterday from a doctor. I was watching CBS News yesterday, and his estimation was the first 6 to 8 weeks of 2022 are going to be rough. He then said, by March, there's a lot more reason for optimism. First of all, do you agree with that, Dr. Whelan? And is there a chance that we're going to see another variant that would extend this even further?
So, yes, one, I do have that same level of optimism. I do think that the history of the Omicron variant in other countries has been a very rapid rise in cases, but then a sharper fall. So that's like our earlier surges, but also what we expect to see with this variant, which would definitely give us that, middle of February, starting to see a rapid decline.
Mm-hmm.
In terms of seeing other variants, I think we'd be foolish to assume we'll not see any other variants. Some of the good information that's coming out is that perhaps having gotten the Omicron variant, people are more resistant to Delta variant. So maybe this kind of multiple variants really will enhance our immune system and will be much more resistant to the coronavirus overall. So we've talked about it from our very first call getting to herd immunity, and we'd hoped we would get to herd immunity with vaccines and not so many people getting sick. I think fewer and fewer people feel like we're going to get to it without everyone kind of getting one or another version of the coronavirus, and that combined with vaccination immunity will create the super immunity to really protect us going forward. So it feels, unfortunately, a little bit more like that's the direction we're headed.
So, Dr. Whelan, a little birdie told me that when the vaccine first came available, it was you personally that created the logistical rollout of how we would all get vaccinated. Is that true?
No. It was a team of hundreds. I certainly was part of the conversations going forward, and I did my time standing out, helping at drive-up clinics and going to the health department and volunteering, but it was coordination between dozens and dozens of people to get that all rolled out.
Well done. Well done. Let's talk about mental health for a minute. You mentioned Sure. Folks are fatigued. How's everybody doing mentally?
It's still hard. I mean, it's people are frustrated and feel maybe even a little hopeless at times when we just are badgering them with this news of new variant, do this, do that. I think that we're all exhausted from that, and our lives haven't returned completely to normal, and so we're all anxious for that, and I think a lot of people aren't sure there'll ever be a normal. I don't want anybody to feel hopeless. I feel very confident that we'll get to a point where we think of COVID as no worse than flu, and it doesn't change our ability to live our lives in any major way. But we've got a lot of recovery to do for all of us, both in our emotional lives, in our physical health, and in all of our workplaces.
Right. We talked about our student population last time you were on, Dr. Whelan. How are and about anxiety and depression with our students and a lack of normal, a lack of schedule. How are our students doing?
So two good things I'd say. I'd say we're seeing definitely a slight improvement there. I think probably the biggest improvement was that we were able to go to school in person.
Okay.
Even though we've seen a lot more pediatric cases in the state, in terms of this coronavirus episode, we being able to go to school in person has really helped with a lot of those emotional, behavioral health stressors that kids were feeling. So I think that was one positive of getting kind of back to normal in the school system.
Okay. And so what you're telling us is parents, send your kids to school, right?
I'm sorry, I missed that.
You are advising students to go to school.
Oh, yeah.
Okay. Very good.
I think the schools are doing everything they can to make people safe, and I think it's still, there is some risk, but we've definitely seen that going to school in person has been better for the kids than when we were shut down and trying to do virtual last year.
How about some advice for parents, doctor? Son or daughter wakes up, they've got sniffles, they've got a sore throat. Do you advise parents to just err on the side of caution?
Yes.
Okay.
So certainly, we don't want them going to school if they're feeling sick.
Mm-hmm.
And then, again, I say this over and over again, I really believe our primary care offices are ready to help them navigate this through testing and guidance for staying home or not. And so I would encourage them to keep their children home if they have symptoms and be in contact that morning with their primary care office about what to do next.
Okay.
Did you ever anticipate, the title of Medical Director of Population Health. So you're at Wayne State and you're going in medical school here, Dr. Whelan. Did you ever envision something like this, a pandemic?
So you learn about it, all the big pandemics in history, and that's how it feels like when you're in medical school. Like, this is something for the history books.
Right.
And you know that it's always possible, but no one ever feels like, oh, I'm going to live through this, or I'm going to be in a situation where 1 million people died from an infectious disease in the United States in my lifetime. But it's happening, and the amazing thing is how fast we've been able to adapt to it. The terrifying thing is how difficult it's been to stay ahead of it, even with all of the amazing technology and understanding we have.
Dr. Whelan, is someone doing it better than the United States? Is there a country that's leading?
I would say there are countries who are still pursuing the path of herd immunity through vaccinations and avoiding widespread cases of the virus. Most of those countries are able to really isolate themselves. New Zealand would be a good example.
Okay.
Not something that the United States is capable of, and with the newest variant, probably not something any country is going to be successful at. So, no, I mean, in all reality, and people, will take this however they want, but the virus has, been able to change faster than we've been able to get ahead of it, and so now we're just going to try and keep people from dying while we get herd immunity.
Okay. And to that, Rich has a joke, don't ask your Uncle Alfred about COVID, go to the experts. Don't talk to people about it on Facebook and get informed that way, go to the experts. How would you tell us to stay informed?
There's a lot of very good sources, people who already are skeptical about traditional medical sources will stay skeptical about the sources that I rely on. So what I would encourage, so you can go to the Mayo Clinic website. The Munson Healthcare website is a great website for information. Go to the COVID pages. The New York Times, the New York Post, or the New York Times, the Washington Post. Basically every major newspaper has an online section on COVID-19 tracking data. But I think it's important, and I've really kind of evolved my thinking on this lately, that we're not all going to agree. Mm-hmm. And what we can't do is decide that if someone doesn't agree with me about, for example, wearing masks, either that they're a bad person, or that they're stupid, or that they're somehow flawed any other way. I think we have to work as a community on being able to have conversations about this. And the end of it may still be, well, I'm going to agree to disagree, but we can get to a point where we respect, treat each other with respect, and we don't agree, but we each continue to follow our, what we do believe in terms of protecting ourselves and our family, without kind of, I don't know what to say, criminalizing the other person's thought or something. That's America. We respect each other's differences. This has been really painful because we feel scared of the other person's decisions. But at this point, I think we still have to engage in those conversations, and so that by the end of this, we can work our way back where we can treat each other with respect and without fear and in a civil way, which we've lost a little bit of.
Dr. Whelan for president, huh? Rich? Have you considered running for office, Dr. Whelan? No, really, it's about respect. Rich got really upset the other day because someone was making light of Omicron with a child. And he got himself so whipped up, and it goes right back to what you're saying, Dr. Whelan. Be respectful of one another and the decisions that you make with the information that you have.
Well, and to me, social media can be very toxic in this way. It's, there's a lot of misinformation, wrong information, false information out there. And, what really got me riled up was seeing a post from a local television station about the number of children who are being hospitalized with the Omicron variant, and people on social media reacting with the ha-ha emoji. And of course that's irritating to me, because that's just the lack of common human decency.
Right.
What's funny about that? There's nothing funny about a child being hospitalized.
Right.
So that's it comes down to that.
Yeah.
Well, we hear stories of those things, and I agree with you that social media has exacerbated a lot of these things, and it's not just about COVID, but the fact that someone would possibly post that someone is hospitalized with COVID, but they weren't vaccinated, that, it serves them right. Or the opposite, that, people wearing masks are, some kind of, someone who doesn't value their freedom or something like that. We can't keep attaching value judgments to our decision making. At this point, we have to listen to each other. We have to respect the fact that someone may not choose to agree with me. I'm strongly opinionated on these things, but I've accepted that not everyone is going to accept my opinion or do what I ask them to do. So So instead of hating or being angry with them, I am just seeking to understand them so that as time goes on, we can find common ground.
I would very much like for us to get to the point where we trust the opinions of experts.
Yes.
Personally, you know what? If somebody wants to come to me and ask me about writing a great radio ad for them and voicing a radio ad, yeah. Great. Come to me. I'm the expert on that.
You're the guy.
But if you're going to ask me opinions about viruses, I'm going to defer to the people who've made that their life's work.
Absolutely.
Yeah.
Well, and I mean that it's one of the lessons we're going to learn from this pandemic is that even the experts have changed what they have to say multiple times over the course of the 2 years, and there have been people with the same credentials as me who have espoused different opinions than I do. Mm-hmm. They might be in the minority, but they still have those same credentials. And so then someone who is trying to trust the healthcare system is left even more confused by that conflict or that changing advice. And we have to work on really continuing to use that as a learning lesson. Like, one, we're learning as we go, so we will change. Two, a difference of opinion is something that is always going to exist, where there's not clear black and white in some areas, and how do we navigate that? So I would encourage people to follow the preponderance of the evidence, and I've said over and over again with you guys even, find someone you trust who you consider the expert, and then follow that.
Right.
And, neither path guarantees you're not going to get sick or that you're not going to die. Whether you're vaccinated, there's still people who get sick when they're vaccinated. There's more people who get sick when they're not vaccinated, but vaccination is not perfect. So I wanted to moralize, and I want to, get on my soapbox and harp on these things, but I've really evolved to the point where now I want to understand so that I can see a future going forward where it's not just filled with conflict and disagreement.
Right. And the numbers don't lie. And so it's so important that we listen to our medical community. Rich has some stats off of your website, Dr. Whelan, and one of them is explaining that of the 39 people in the ICU, 38 were unvaccinated and one was vaccinated. Those are hard numbers.
Yeah, and so we know, I mean, from our perspective, and again, in the hospital, you are 20 times more likely to die from COVID if you are unvaccinated than if you're vaccinated. Like
Wow.
that is very real numbers.
Mm-hmm.
And that terrifies us because those people who are dying are still real people. And we feel like it could have been prevented. However, before we had COVID, we had smoking. And there's no doctors who still would walk around saying, oh, yeah, smoking is not that big a risk. We all know you're way more likely to die of multiple things and die younger if you smoke. But it wasn't with the same frustration bordering on hatred that we sometimes see now.
Right.
And so, Americans have always been, able to make unhealthy choices.
Well
the fact
said.
that it scared us so much is what makes people angry and frustrated back at someone who might be making that unhealthy choice in our perspective. But I think we have to keep moving forward to saying, okay, you've made your unhealthy choice. You will face the consequences. I will try and help you get through it anyways. And I think that's really our path forward, and hopefully to feeling less stress and anger and frustration with each other.
The definition of a leader, Dr. James Whelan. He is the medical director for population health at Munson Healthcare, a very busy man of the hour. Thank you so much. Happy New Year to you, Dr. Whelan, and thank you for keeping us healthy and safe in the Cadillac area.
My pleasure, anytime.
Dr. Whelan,
thank you guys for being an avenue for us to get, this out to people.
Absolutely. And we look forward to a day, Dr. Whelan, when we can have you on the show and not have this as our topic.
We don't have to talk about this word, that word. So very happy, New Year to you and to the entire healthcare community. Thank you for taking care of us.
Thank you, guys.
All right, Cadillac Unscripted. Join us next week, same time, same station, for some more local chat. We might be talking about New Year's resolutions next weekend. Who knows?
I think so. They're coming.
On Cadillac Unscripted 107.9 CDY, sponsored by Independent Bank. One thing we do want to add in honor of the second anniversary of Cadillac Unscripted and also in honor of our 100th show just a couple weeks ago, Katy Huckle is very famous for her cakes. She makes what's called Katy cakes, and they are decadent, they are rich, they are wonderful, and sometimes at local fundraisers, they go for hundreds of dollars in terms of bidding for nonprofits, to help out nonprofits, and that's a passion that Katy has, and we are going to share some of that passion with you. So we would invite you to go to our Cadillac Unscripted Facebook page. If you haven't liked it, like it. And in 2 weeks from today, on January 15th, one of our Cadillac Unscripted likers on Facebook is going to win a Katy cake of their choice. All you have to do is just go to our Facebook page, our Cadillac Unscripted on 107.9 CDY Facebook page, and drop your name in there. Just simply say, I'm in. And we'll give you a chance to win coming up in 2 weeks. We'll determine our winner sometime a few days prior to the January 15th show. So get yourself entered. You could have a chance to win a Katy cake just for liking Cadillac Unscripted on 107.9 CDY.